Before the examination of the nose, introduce yourself to the patient and briefly explain the procedures of the examination. For all examinations of the nose, the patient sits on a chair which provides adequate back support. You, as the examiner, will sit beside or in front of the patient. Your eyes should be at the same height as the patient's nose. First, we examine the external nose. Materials needed are head mirror, gloves, and a drop light. The basic principle of the head mirror is that light is reflected from the mirror onto the patient. It has a hole through which the examiner can look, thus allowing binocular vision. Correct positioning of the patient, the examiner, and the light source is important. To use a head mirror, place the mirror over the left eye, close the right eye, and adjust the mirror so that you can look through the hole directly at the patient's nose. The drop light is positioned slightly behind the right side of the patient's head. Now adjust the light and the mirror until the maximum amount of light is reflected onto the patient. When the right eye is open, you should have binocular vision and the reflected light should be shining to the patient's nose. The focal length of the mirror is approximately 60 centimeters. This means that the reflected light will be brightest and sharpest when the examiner and the patient are this distance apart. To examine the external nose, ask the patient to hold their head up straight and aim the reflected light onto the patient's nose. Describe the color and smoothness of the covering skin. Assess the position of the nose and look for any visible swellings. Ask the patient to hold the head slightly backwards so that the nostrils and the columella become visible. Check whether the nasal columella is straight. Press the tip of the nose slightly upwards with your thumb. The frontal part of the nasal vestibulum will now become visible. Check if there is any pus, mucus, blood, or possibly a foreign object visible in the nose. Take hold of the nasal bone between the thumb and index finger and move the covering skin carefully over the bony part of the nasal skeleton. Note any swellings and other irregularities on the surface that may indicate recent or old damage to the nasal bone. Ask the patient whether this is painful.
Is this painful?
While filling the nose with your fingers in this manner, palpate toward the nasal tip. For any swellings that you may come across, describe the size, perimeters, surface, consistency, and mobility in relation to the surrounding structures. Finally, assess the accessibility of the nose. To do this, first place your thumb over the nostril not being assessed to occlude airflow. Ask the patient to breathe in through their nose and note the degree of airflow. Repeat assessment of the other nostril, noting any difference in apparent airflow. Next, we examine the nasal cavities through anterior rhinoscopy. Materials needed are nasal speculum, head mirror, gloves, and a drop light. To examine the nasal cavities, ask the patient to hold their head slightly backwards so that the nostrils and the columella become visible. Aim the reflected light into the nostrils that is to be examined. Hold the nasal speculum with your hand in a neutral position between pronation and supination. One leg of the speculum should lie in the palm of your hand in the groove between the tenor and the hypotenor eminences, while place your middle, ring, and little fingers against the other leg of the speculum. The index finger should lie against the speculum blade. Place the forefingers of your other hand on the patient's forehead and press the nasal tip slightly upwards using the thumb, allowing you to properly assess the position of the columella and the frontal part of the nasal septum. Now insert the closed nasal speculum with the blade parallel to the nasal floor. If the tip of the nasal speculum has passed the nasal valve area, carefully open the nasal speculum. The inferior and occasionally the middle turbinate are now visible. Describe the mucosa covering these structures, plus the presence of any pus, mucus, or blood. The inferior and middle meatus should also be visible now, and can be assessed for the presence of pus, mucus, blood, or a foreign object. Once you have finished the examination, remove the nasal speculum in a slightly open position from the patient's nose. In this manner, you avoid trapping and removing any nasal hairs, which can be painful. Repeat assessment on the other side of the nose. To complete the examination of the nose, thank the patient, wash your hands, and summarize the findings.